Good afternoon. Welcome to Advocacy Insights, NEHA's monthly podcast on environmental health happenings in government affairs. First of all, I'd like to make a mention. Our hearts go out to our friends and colleagues at the CDC. The tragic events that we saw last Friday has left us all really confused and dismayed, but it does show our resilience. We are going to be back. The attack on the CDC headquarters by a lone gunman shows how politics has crept its way into public health. This is not something we have wanted, but it's something that is occurring. We've always seen ourselves as being above politics, instead being guided by science. But these events prove that we cannot ignore government affairs. Politicians and the people they represent, how they view us, is important. And it is going to be very important to our profession as we move forward. With these thoughts, I am coming to the annual fiasco known as appropriations. Although the president and his administration oversee the day-to-day operations of the federal bureaucracy, it is the Congress that has the power of the purse. They dictate how much money each agency receives and for what purposes. And every member of Congress has some say in this complicated process, from the very powerful chairs of each of the Appropriations Committee in the House and the Senate, to every member of Congress. Even the ones who don't serve on appropriations, they all have a say. They all must vote to pass these appropriations package, which funds the federal government. Each one of these fundings are for 1 year. These are not long-term packages that go on for several years. Every year, we annually have to approve how much money each agency gets and for what purpose will that money be spent. With this in mind, I ask our guest today, Harold Chase, to speak with us on his thoughts on the appropriation process, how it's progressing, and what impacts it'll have on the various agencies that support environmental health, specifically CDC, National Center for Environmental Health, and FDA's Human Foods Program. Harold is with NSF International, after previously working for Senator Carl Levin from Michigan. Now at NSF, he monitors congressional actions regarding environmental health, funding, and policy. So with that, I'm going to turn it over to Harold. Harold, good morning. How are you?
Morning, Doug. Doing great.
Good, good.
Happy to be back.
That's good.
That's
always good to hear. It's always good to see you.
Yeah. So I was with Carl Levin for 17 years, and I actually did 4 of those years. I was his appropriations staffer, so I coordinated all the appropriations work and requests that we made through that office. So and worked with the appropriations committees on a lot of these issues. So really got enmeshed in kind of the details of how this process works, or maybe doesn't work, to be quite frank.
Yeah, it was probably pretty fascinating to be on the inside to see what his thoughts were, his concerns were, how appropriations supported not only Michigan, but Detroit, and even NSF International. What were some of your concerns while you were with Carl? What was his biggest environmental health boss? Did he have concerns about PFAS?
Well, that was PFAS. While it was out there, it was not something that was very high on anybody's priority list. I've been out of the Senate long enough to where it wasn't something that got a lot of engagement in Congress, at the very least. Before there were literally hundreds of bills in the state legislatures and the federal in Congress now. But from an environmental health, I had the good fortune of working not only in Washington, D.C., doing policy work and appropriations. I spent quite a time with him in northern Michigan in a couple of his regional offices. And so what was great about that is that I actually was able to take him in and meet with some of the local health departments while I was there. I kind of grew up in public health. My dad ran a health department up there. So,
Right.
it was always my pleasure to take them in and, talk about these issues that were impacting people, especially some of the public health funding, that comes in and how important that was. So I could kind of show him on the ground what was going on in communities. So of course, with public health writ large, a lot of that was, of course, the maternal health programs, and then, of course, even, a lot of the food benefit programs that impact people, that a lot of that can go through the health departments, but then even into the environmental health and some of the impacts and how important those, different funds were from sources to protect the environment and, huge impacts on people's lives that they didn't really maybe think about that was helped by the federal government.
We're in the August recess. We're in the downtime. You're there in DC in the heat and humidity. What is going on? Where does the appropriations process stand right now in mid-August?
It's a mess. I mean, to be quite frank with you, we've had a lot going on this year, a lot of concern about where we're at. So the appropriations themselves, we are actually operating under what's known as a continuing resolution. So
Okay.
even though we are in fiscal year 25, we're essentially operating off of fiscal year 24 dollar amounts with some what are known as anomalies. So the CR did have some tweaks, but for the most part, it's those bills that were crafted for fiscal year 24. What's kind of important about that is we passed two different consolidated appropriation continuing bills back in March of this year. There's 12 total appropriations bills, so we passed them in two buckets of 6.
Mhm.
The reason I'm kind of getting back to this history is that the Senate Democrats in particular, Leader Schumer, was heavily criticized by his base for supporting those bills. His base was really demanding that the Democrats take and fight the president, fight these actions, and fight some of the budget proposals that he was pushing, not only in the continuing appropriations, but writ large. So they wanted to fight. So that's sort of important to comprehend and understand what was going on last spring and the pressure that the leader came under for agreeing to pass appropriations, the continuing resolutions. So, and where we're at now is that we're trying to negotiate out agreements. In the Senate, we've had none of the bills have passed, though the Senate has been working, and they have a bipartisan agreement on 8 of the 12 appropriations bills, and so that's agreement between the Dems and the Republicans. The House Appropriations Committee has actually passed 9 of the 12 bills, but however, none of those have bipartisan support. For the most part, they contain either riders are called, language that is not supported by the Democrats, or they cut the funding levels to where the Democrats can't and won't support. So this is where we're coming out of the summer recess here in a couple of weeks, and we'll be in the fall faced with the House and the Senate needing to wrap up all 12 bills, pass them through both houses, and then reconcile them. So one of the points I want to make here too is that in this process, the regular appropriations process, bipartisanship is necessary because the appropriations bills are subject to the Senate filibuster. So they need 60 votes to pass. So that's a pretty important point.
How much time do we got left between now and when we have to get everything passed?
47 days as of today.
Okay, so and how much time? They're not going to be back in session until September, are they?
Yeah, no, they're both scheduled to return on September 2nd. The House is actually, so in session days, I actually did this math because that's just what you do when you do this job. 14 days the House is going to be in session and the Senate's in session for 16 days. What's kind of critical there is that week of September 22nd, both the House and the Senate will be out that week for Rosh Hashanah. So they are
The
not in
entire
session.
week?
The entire week. Yeah,
So
right at the end of September, and then we're back for a few days before the end of the fiscal year. Now, what's kind of important is that a lot of this work is done behind the scenes of negotiations. So just because you're not in a session day doesn't mean they're not working on it. They'll be working through the weekends.
Yeah, the staff is behind the scenes working on it, trying to promote their sides and trying to figure out which way to go. Where do we stand right now with let's say, the CDC's National Center for Environmental Health? Where's that budget process look like?
Yeah, so that is actually in the labor HHS education bill, which is one of the more difficult bills to pass. I think you've talked about that in some of your communications out to your members. So it's a difficult bill. We do have a version of that bill in the Senate. We don't have an actual dollar amount for that, but the bill itself, I think is probably reasonably okay in the Senate. We don't know in the House. We haven't seen that bill in the House. It's a difficult bill, so we're just waiting to see what those numbers are going to look like, and that will kind of, wherever the House comes in at, that will set how the negotiation will need to occur to reconcile between the House and the Senate.
So last time, or let's put it this way, the administration puts out their version of what they'd like to see the budget to look like. And because they have this whole thing going on with the Administration for Healthy America and the Division of Environmental Health, they cut back severely the funding for the National Center for Environmental Health, with the idea of most of those programs going over to the division. But that's just what the president wants to do. We haven't heard the House come out with similar numbers yet, have we?
No. In fact, I mean, that gets part of this reorganization that's going on in HHS, and so we do have this ongoing initiative to reorganize. I'm actually not all that aware of where we're at in that process. I do know that they had before this all started at the start of the president's when he was sworn in, there was about 82,000 people at HHS, and so between the reorganization proposal as well as the early retirements, some of these efforts that you had heard about probably through Doge earlier this year, that the goal is to take about 20,000 employees out and take it down to about 62,000. And so they're also looking to consolidate there's 28 divisions at HHS and take it down to 15. In doing so, they also want to create this Administration for a Healthy America, which, the focus is going to be chronic disease prevention, behavioral health, community health services, and also includes environmental health. That's one of the stated goals of this administration for Healthy America, is to include environmental health. So it's all about supposedly improving the coordination of health resources for low-income Americans.
Yeah, but it really needs congressional authority. So if the House comes forward with language to support that, will that, how does that affect the chance of negotiations with the Senate?
I think it depends on what that language reads. I mean, reorganizations on their own aren't necessarily, good or bad. You might, depending on how this worked and what resources, what programs. I mean, I think some of the criticisms that I see about, this particular proposal is that it's a lot of, branding, so to speak. They're shuffling the deck a bit. But what are the actual initiatives and programs that are going to be run? How, what is that funding going to look like that goes through that? And how is that going to be distributed? So I think that's the bigger issue here. A reorg in itself, it's hard to say that that's necessarily gonna engender a huge fight on its own. I think it's more what does that reorg actually do?
So what, I'm trying to link this back to the appropriations
Yeah.
process. So if the House comes forward with a standard saying we're going to keep the National Center for Environmental Health, we're going to keep CDC like it is, we're just going to put money in there, and let's say we got a $20 to $50 million difference between the two, we got a good chance of something coming out by October. But if they throw language in there that's really going to address this reorganization, to move sections of CDC over to a new division and create a new division in and of itself, that could be problematic for getting something done, because I don't think we've seen support from the Senate. Have you?
No, I have not. And I mean, it could be. Now, however, I very uncertain to me about how the chances of the reorg, happening or not happening, depending on congressional language. I mean, there are laws that are in place and existing language. However, I got to tell you, if you would have asked me, last year, what were the odds that, somebody could just come in and, essentially eliminate USAID and, put it all into Department of State, I'd have been like, well, that's not legal. Well,
yeah. It is.
Whether or not the legality of that, I mean, that is essentially what has occurred. So, I think that we have to be very cautious when, we start, looking at the proposals from the administration as to what, they can and cannot do or will do. Eventually some of this stuff will work its way through the courts if they decide to go ahead, but then it's going to be up to the courts to decide how, these proposals are being, implemented.
Right. It's going to be, like you said, very interesting. We don't know what the future is going to be, but for the current, they have to come up with something, and they got to agree with this. And so, even though, as you said, the House can simply vote with their simple 4-member majorities, of 4 or 5-member majorities.
I'm not sure how simple that is. We can start getting into the math of the House, though. They've done a pretty amazing job of kind of, coming together and passing bills that the president supports. But it is, just because they've been successful doesn't mean that they're going to continue to be successful as you get into some of these very contentious issues.
So like you said, when we get in these contentious issues, Speaker Johnson can afford to lose 4 votes, 5 votes?
About 4, yeah.
About 4 votes. And so 4 of his Republicans is all it takes to gum up the process.
That's correct. And even, so that gets problematic. So this is where, the appropriations process is going to be very problematic because of this necessity to negotiate with the Democrats and come to agreement because of the Senate filibuster. You then also are faced with a significant group, more than enough to derail House action, who might feel that not enough spending is being cut. So how you bridge between that faction in the House who can derail action and the Senate filibuster, that is the real, literally $1 trillion question.
And these people, they're not even on appropriations. They could have nothing to do with environmental health at all. Yet they can step up and say, well, wait a second, the president wants X and it's not in the bill, so I'm not going to vote for it.
That's correct.
And then so it's very tight.
Yeah. I mean, it's tight, and it's literally a tightrope that needs to be walked. Realistically, what this is going to take is agreement between the president and the Democratic leadership, in particular Schumer. We did see on Wednesday, the president said that he would meet with the Democratic leaders, though he also said something to the effect of it's almost certainly a waste of time to do so. He downplayed his thoughts that, any meaningful dialogue will really happen with that, but he is open at least to having that discussion. So, that might just be Trump's way of trying to push the Democrats. He thinks that, he certainly has leverage here, and that's where he tries to negotiate from, is a position of strength.
Right. So, so from your point of view, the big player is Speaker Schumer, my apologies, Minority Leader Schumer,
Yep.
and the
Yep.
president. That's where the key is coming in.
Yeah.
What about the House, Hakeem?
Well, we need, you are going to need Hakeem, because what gets interesting in the House is that because you have potentially enough Republicans who don't want, who might not agree to certain bills because they don't cut enough, so certainly if we get into a situation, for example, where we need a continuing resolution here, at the end of September. So a continuing resolution for the most part would, maybe with some, as I said, anomalies earlier, keep funding level where it's at. There are probably more than enough Republicans who will not support that without the Democrats, that bill can't, a relatively clean CR cannot pass the House. So
Okay,
this is where you need
I better put a little time out on that one.
Yeah.
So if it comes to the end of September, we need to have a CR or we're going to have a government shutdown.
Well, yeah, if they haven't passed any of the appropriations bills, if they've passed any of the appropriations bills, then you get what's called a partial shutdown. So let's say that maybe they were able to get agreement on Department of Defense or the VA, and they pass those, or one of the other bills, then those agencies would be taken care of. I'm not saying that that's necessarily going to happen. I think it's probably unlikely that any of the bills will pass both the House and the Senate by the end of September. But that is where we're at. They either pass some bills or they pass a CR, and if they don't, yes, it's a shutdown.
And then if we can't get, or if Speaker Johnson cannot get all his Republican members together, or if he loses some, he cannot get Democratic support to pass a continuing resolution. I'm not talking about appropriations, just the continuing resolution to keep the government open. We close down?
Well, yeah, I mean, all but essential functions, and that's where there are essential functions that continue to occur. This is where it starts getting tricky, because there is something called the Anti-Deficiency Act. And so there are some old opinions from the Attorney General back in the early Reagan era. So Reagan's Attorney General, which stated that in a lapse of appropriated funding, that it is a violation of the Anti-Deficiency Act to expend funding. Now, however, that's what we've been ruled on for all these decades since the 80-81. The question I have, and I have not seen any indication one way or the other on this, but I'm not sure what is to stop Attorney General Pam Bondi from rescinding those opinions and giving broader. Really? Well, let's just speculate here. I mean, I don't know. I'm not saying that's going to happen, but they are just opinions. And so if she rescinded that opinion, prior to those opinions, in the 70s, even after 1974, when we passed the modern appropriations and budgeting bill, lapses in appropriations were actually very common, and government continued to fund itself during that period. Agencies didn't shut down. It wasn't until those opinions came out that we were faced with that consequence.
That's very interesting. It's also very interesting that previous administrations didn't pull back from those opinions as well. Well, so let's get the lay of the land. We're in the middle of August. They have 47 days to come up in an agreement. The Senate has passed out the Ag bill, and they passed out labor, didn't they? Or, yes. I'm sorry, label HHS. I should really put that out. The House has not passed either, if I remember correctly, or did they pass ag?
Well, the committee passed ag.
Okay, the committee, but it had which committee? The subcommittee or the full committee?
That is, let me pull that up really quick, Doug. It's, I just had this table up. So yeah, the ag is gone by the full committee. None of the
Okay.
bills have passed the full, they've only done committee passage.
Okay. And then they need to get the full House package or the full Senate to agree with it. And once they do that, then they have to negotiate between each other about what numbers come up.
That's correct.
Okay, so they're going through, they're trying to get the easy bills done, which is ag FDA, which is a very unique situation because the FDA and the Human Foods Program is funded under the USDA agriculture bill, correct?
Correct. It's in the, even though they're part of the Department of Health and Human Services, they're actually included in the agriculture appropriations.
And then the other one is HHS, or what is known as labor, HHS, and pensions, education and pensions.
Yeah.
The help, which is much more complicated, much more controversial. And again, we still need to get the subcommittee to come to agreement, the full committee to come to agreement, the entire chamber to agree, and then the two chambers must come to an agreement before we have an appropriation.
It's a lot of work in 47 days.
It's a lot of work in 47 days. So explain to us just one more time, we either have a continuing resolution or the government shuts down.
Yeah. So at the end of September, so on, at midnight, 12:01 a.m. on October 1st, if there is not, if they haven't passed any of the bills, or if they haven't passed a continuing resolution, then you are in a shutdown. Now there are some things that traditionally have been done in the past decades. If they've signed a CR or passed a CR like late in the night on that deadline day, which has happened more than once, there are some measures that can be taken by the agencies to continue operating. It's usually on a weekend. So when it's on a weekend, it makes it easy. But that is, that's where we're at. So we either pass some appropriations or we pass a continuing resolution. Otherwise we are, in a shutdown. And then there are certain programs, essential services, that do continue operating during a shutdown, but others that do not. Usually the pressure of a shutdown starts to hit about 30 days in. And that's when things like your air traffic controllers are going for their maybe second missing paycheck, and they're getting ready to walk off the job. And then that puts extreme pressure. That's what things start breaking down after about 30 days, when people have, even essential workers aren't getting paid. Everyone typically gets retroactively paid.
Yeah.
So, I think any of the federal people who are listening to this podcast, I've been through this. I've been through a shutdown. I've missed a paycheck, but then I got retroactively paid. But
that doesn't help your mortgage, does it?
It's difficult. Yeah. And so the longer it goes on and you miss a couple paychecks, and it starts to get difficult.
Yeah, I could see that. So neither party wants a government shutdown. It's not advantageous to anybody.
Typically, no. It's not advantageous. But where we don't know is if we think that one party or the other thinks that, maybe this time they have an advantage. And that's what's happened in the past, where you have, one side or the other thinks that it's advantageous to go into a shutdown. And I'm not saying, I have no idea who, typically it's whoever is in control. It rebounds on them. In this case, I think, probably would rebound on the president, but I'm not sure that he feels that way. So we'll have to see.
Gotcha. Well, let's talk about a couple things that happened over the summer, and hopefully you can enlighten us a little bit about that. What happened with reconciliation earlier this year?
Well, so we got a couple things going on here. reconciliation, I immediately, I want to make sure that we're on the same page here. I immediately go to the One Big Beautiful Bill Act.
Absolutely. That's what I'm trying to get to.
Yeah. So, that passed, so that was a bill that passed just earlier this year. Sorry, I was just trying to look up my notes on this. And that is, a reconciliation bill that is allowed for, actually Congress could do up to 3 reconciliation bills in 1 year if they really wanted to, because reconciliation is a process that was set up in the modern budgeting and Congressional Budget Act that passed back in '74 that I mentioned earlier, that set up the whole process. And so while appropriations are subject to the filibuster, the reconciliation process that can then be used after appropriations have been passed, 3 times a year on spending, debt and taxes, and it can only impact this very narrow set of issues. It can't be used for just generic policy issues. That is what they use to pass this One Big Beautiful Bill. And so that passed earlier in the year. Actually, I don't have the date, but I know it was just a little bit ago.
July 4th, wasn't it?
Yeah, he signed it on July 4th,
Right.
Independence Day. So,
help me out here. This act did all this stuff, yet we only had a narrow, it was only reflective of reconciliation. It's only reflective of a small, narrow point. How was Trump able to do all these policies within this one act?
Well, that gets really difficult because they had to really put, actually the most powerful person in government during this process is the Senate parliamentarian. So the Senate parliamentarian actually, because in the Senate, again, reconciliation is not subject to the filibuster, but there are very narrow avenues that they can pursue. So that's so even though he did all sorts of different things, they're all were very related to the budget and spending. And so that's really where it has to be. And if you get outside this narrow scope, the Senate parliamentarian can make a ruling that it is not, within the scope of reconciliation. And then it gets very difficult to overrule the parliamentarian. I think it's a 3/5 vote, if I recall correctly. So it's a very high bar to overrule the parliamentarian, which is not going to happen in this particular Congress. So that is how he was able to do that. And then he actually had to really put a lot of pressure on particularly House members. The president, was personally calling and whipping on that bill to get enough House members to support, because they didn't feel that what the Senate did went far enough. And so it was extremely difficult. In fact, I think it puts a lot of credit on Speaker Johnson and the president for getting that, that priority passed. That was something that would have been difficult to think about even a year ago, that many of these certain members would have voted for this bill, which they did not feel went near far enough.
So it was really a dicey situation. Had the president not personally gotten involved and really put pressure on how his members, that whole thing may not have happened.
Oh, absolutely. 100%. It was, he had to apply a lot of pressure. And this is where it probably did consolidate his control of that party even, further. Just the fact that he successfully did that, and he got a whole bunch of members who would typically not have supported this sort of thing in years past to get them on board. I think in fact, it'll probably make it a little easier for him going forward in similar situations. The fact that they ended up flipping, some of them even said that they would never support this, and then they ended up supporting that.
That was like Chip Roy from Texas, and Thomas Massey, he never supported this, did he?
I don't think Massey ended up supporting it, but most of the others did. I don't have a list, but yeah, there's a whole list of them that supported. But I do, to me, it's just my opinion. I think it's going to be very difficult for those members to, say that they're going to oppose in the future a similar type situation on spending or the debt limit or whatever the issue is. And so long as Trump is in office and actually follow through with that.
Yeah. So if we had a Democrat during a Democratic administration, they had no trouble voting against anything. But with Trump in office, they kind of changed their mind pretty quick.
Yeah. And let's be clear. I mean, all the bipartisan and nonpartisan analysis of this one big beautiful bill, they do indicate it's going to increase the deficit. There are some partisan opinions that it's going to decrease the deficit, but that's a minority view. All the nonpartisan analysis I look at indicate that this is going to increase the deficit, and that is something that anything that is predicted to increase the deficit. If a Democrat had been trying to do that, many of these Republican members, they would have never supported that.
So if we're in favor of expanding the government, we need a Republican in charge, sounds like.
Well, to at least expand spending, but not expanding government. Steady. Yeah, I mean, though I think to be honest, this going off a little bit from what we're supposed to be talking about, Doug, but it's like it's not even clear to me that all these efforts to shrink government are really at the end, are going to prove to be overly effective. I mean, by the time the courts rule, and it's hard to say. And then they've been bringing some people back, so there'll probably be some shrinkage, but it's very, very uncertain where things lie with these agencies, especially as they determine. We saw this at FDA, which is somewhat consistent. We had a whole bunch of downsizing at FDA over the summer, but then within a week or two, many of those people who were told that they were gone were brought back because it turned out that they were actually needed to do some very essential things that were important to Secretary Kennedy, for example.
Before I get over to the whole Dodge fiasco, let's finish up with what was rescission.
Yeah.
Can we talk about that real quick?
So the rescissions. So rescissions was a much smaller bill that went through just a little bit ago. That rescinded about where's my notes? I think about $9 billion in funding, and this was really rescissions was the foreign aid. So that actually put some legality behind that USAID funding that was pulled back earlier this year, as well as Corporation for Public Broadcasting. So that was officially $9 billion in funding, about $1 billion for corporation, maybe just a less, and then the rest of it was foreign aid. So that also just needed a simple majority vote. This is a process. I'm going to get a little bit into the weeds here. The rescissions process. The president can propose rescissions to Congress. He can identify money that he does not want to spend, and he can send it to Congress. Once that has been transmitted to Congress, that starts off a 45-day clock where Congress has to approve or disapprove of that rescission. If they do not do it within 45 days, the rescission is dead, and that money is supposed to be spent. But what gets interesting here is that, so we had this $9 billion package that did get approved, simple majority vote, all the way it's supposed to work. Again, a lot of arm twisting because there were some people who wanted more, but sure. There are no real, I'm not aware of any limits on the number of rescission bills that you can propose. So, I mean, they can just keep sending rescission bills. But what gets interesting is that OMB has taken the Office of Management and Budget. It's part of the White House. It's a very powerful part of the White House. They have taken the position that there is something called a pocket rescission. And so a pocket rescission is where the president, within the 45-day time window, so when we get down below 45 days, which I will note is this Sunday, if the president proposes rescissions, Congress does not act upon it before the 45 days, and then the end of the fiscal year happens, that those funds are automatically rescinded. Now, there's a lot of disagreement over whether or not that's legal. GAO currently holds that it is not legal. And so that would be up to the courts again, ultimately, if they decide to do that. But what's going to make this difficult is that the original rescissions package, the Democrats took the position when that passed, the $9 billion, that it made it very difficult for them to come to an agreement, because they came to a CR agreement back in March that they were heavily criticized for. But they went through with it. And then the president turned around and proposed this $9 billion rescission of congressionally appropriated funds for programs that the Democrats highly supported, and that could be passed with a simple majority. So it makes it much more difficult for the Democrats to come to an agreement on even a CR, let alone appropriations, if the president is going to be using proposing rescissions that can be passed with a simple majority vote.
So you just added another complication to already a very difficult process.
It's, and this is something that, and these are statements that you can go, and Leader Schumer has been talking about this a lot, how difficult this goes. One of the reasons why he was opposing rescissions, why he doesn't want the president to propose any more rescissions, because if they're it makes it difficult for his members to come to agreement on spending. Yeah. And he's been very vocal about that.
Yeah, and it's coming from the members. So this is something that when Trump does something, when the president does something, it's the members are saying, look, why am I going to support anything that he wants to do?
Yeah. And then don't forget that a lot of these Democratic members, they're under very heavy pressure from their voters. Yeah. So they're Democrats, many of them, and they have progressives, they're in blue states, blue districts, and their people who they represent are very angry. They're very upset with the president. They do not want to come to agreement with this president. They don't want to compromise with this president. And so that puts a lot of difficulty on these members to actually support anything.
With our final few minutes here, let's get back to our earlier discussion. What did DOGE actually end up doing? What did it end up actually long term? Are we going to be able to, are these reductions in force going to be sustained, or do they need congressional action? What's going to happen?
Well, I mean, I think that a lot of this is, it's hard to answer that 100%, because a lot of this is still playing out in the courts. And so this is a process that takes a while. So, all these actions that the president is taking, many of them are taking, they're often taking very extreme interpretations of law, asserting authority where maybe others say they don't have it. I don't, I'm not an attorney. I'm not going to make an opinion on that, but, the courts are going to decide that. And so, yes, certainly as these, cuts wend their way through, many of them may be undone. But even if they're undone, it's very uncertain how then you undo something that has been in effect for months and months, and potentially over a year by the time some of these cases go through. But that being said, we've already seen where these impacts start to show up, and it's always was going to take a while for these impacts to be felt. But as they start getting felt, that is when, you start seeing pushback and you start seeing changes. So it's as you downsize, like Department of Agriculture is going through a big reorganization right now. And Absolutely. As they downsize, if you start seeing impact on some of these farm programs, that you get into a strong Republican base there. And so will you start seeing pushback potentially, and as these impacts are felt, that's when you start seeing the pushback.
Well, Harold, what a day. What a time we live in. It seems like there's never ending reasons for us to be on the pulse of government affairs, because it really does impact the environmental health community, the environmental health profession. With that, I'm going to say thank you again for giving us this time this morning to speak on what's going on in the federal government, the federal appropriations process. Any final words you'd like to share with our audience?
Well, I just, I was privileged enough to attend your NEHA AAC just a few weeks back in Phoenix. It was a great event, and I gotta tell you, it was so heartening to talk to all these environmental health professionals from around the country, and the hard work and dedication that they're doing. And, one of the messages that I want to give is that, as we're discussing these really big issues about funding and about the federal government, their voice is so critically important in this. And for them to engage with their members, your NEHA members are all over the country. They're, the Democrats, they're Republicans, they're, both parties, and committed to protecting environmental health, and they're represented again by both Democrats and Republicans. And so, actually going in, if you want to have an impact, getting in, talking to your local congressional staff, talking to your members, especially now in August when they're back, probably back home. This is a really great time to be engaged and just start talking about the importance of these programs, so that, as these bills are being discussed, this funding, hopefully will be protected.
That's very good advice to have. Thank you very much. With that, I'm going to say thank you, Harold, for joining us this morning. Thank you to our audience out there in Advocacy Insights from NEHA. This is Doug Farquhar, Director of Government Affairs, saying thank you and have a great afternoon. Harold, take care.
Thanks, Doug.